Health Today is brought to you by Caribbean Alliance Insurance, agent represented by BGI Insurance Limited.
Are we killing our children with food? In this edition of Health Today, we examine the problem of childhood obesity.
Childhood obesity has been now recognized as a public health problem within the region.
Children are getting bigger, and typically in Barbados and the rest of the Caribbean, we often think that being chubby or pleasantly plump is better. But that's far from the case. It's really a ticking time bomb to early death. In fact, health authorities warn our children are in danger of being more sickly and dying younger than our generation. Acting Chief Medical Officer Dr. Kenneth George tells Health Today the latest figures are troubling.
The Ministry of Health has data to suggest that about 30% of our school-age population is overweight and another 10% is obese. So the group is about 40% we're looking at. In terms of obesity for adults, we are in excess of 60% of the population being either overweight and or obese.
For those who think it's just a phase children will naturally grow out of, we have bad news.
Childhood obesity later on leads to adult obesity, and adult obesity is associated with heart disease, stroke, hypertension, diabetes, which are the major killers now, some forms of cancer. Even now, we were recently told it's a risk factor for a failing heart. So that obesity is the forerunner. The reason why Barbados has almost close to 20% of our older populations having diabetes is the obesity epidemic.
Overweight and obese children will not only suffer from poor physical health, they may also have to grapple with poor self-esteem and depression, since they are more likely to be teased or bullied. Childhood obesity occurs when a child is well above the normal weight for his or her age or height. The best person to determine whether your child is overweight is your child's doctor. The doctor will measure your child's weight and height and compute his body mass index. Dr. George says though many factors lead to obesity, our lack of physical activity and poor eating habits are driving the epidemic.
From our data, most children drank at least one carbonated beverage a week. That was 75% of the children drank at least one carbonated beverage a week. They're not attaining the levels of fruit and vegetable intake. So the parents need to be aware of this, and also in fairness to the children, we have to develop healthy options for them. So we shouldn't say don't eat this, don't eat that, and not have an alternative.
There's no magic pill or 7-day diet to fix the problem of childhood obesity, but Dr. George is quick to point out it's not all doom and gloom. He simply recommends that parents make gradual, healthier choices for their kids.
We need to try to inculcate fruits and vegetables in the children's diet, and we need to also reduce the amount of carbonated beverages, the amount of salt they consume. A lot of these snacks have a lot of tremendous amount of salt, you know, and work with the parent-teachers associations and the home economics department.
At the national level, the Ministry of Health has already teamed up with the Ministry of Education to tackle the problem. The acting chief medical officer does not believe Barbados is ready to adopt legislation that would regulate how much fast food is made available to the public. Rather, he says, the island must enlist critical stakeholders in the fight.
I think we can try to do more education and, among our youths, among parents, trying to let companies know of their social responsibility with respect to their products, because we know that they are looking for their market. We know that. But they have some social responsibility to the people who they sell their products.
You too can start a health revolution by following this week's health tips.
Encourage your children to drink water. Serve water instead of a soda at the end of a meal. Do not keep unhealthy foods in the house. Encourage physical activity at school and at home. Do not use food as a reward or a punishment. Be a good role model. Children eat in the same way that their parents do.